Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Today's topic, we're going to talk about Western medicines treatment for fibroid. Now we cover about Chinese medicine and acupuncture for fibroids, and we cover what can you do at home for fibroid, like acupressure point and moxibustion, right? It was yesterday. Now this morning, we're gonna cover Western medicine for fibroid treatment. Okay. Now, if you are watching this live video or you replay this live video, please say hi and leave some comment and let me know where you're from. Say hello to me. For those that I know you well, you don't have to do that. You just say hi to me. You didn't have to tell me that where you're from. Hi Eric, how are you? So this is a live video, so when I see anyone that come up in front of me, and I'll say hello to you. Okay, I'll say hi to you as well. Okay, so this is another vlog. A vlog can go straight to the contents. A live is more relaxing, like we can talk, you can ask questions, all this thing. Okay, so yeah, more importantly, if you're on Facebook and Instagram, please share hi happy day on Instagram. I'm doing well, thank you. Yeah, right. Now I have seen someone in the my clinic page as well, Facebook page as well. Can you please say hello? So therefore I know who you are. Okay. And I got Raji Guhan. And sorry, I'm not very good at pronouncing your name. I'm pretty sure you're from India. And hi, thank you for saying hello on YouTube. Thank you very much. Okay. Now let's start. So using Western medicine to treat fibroids, okay, your doctor will develop a treatment plan based on your age, the size of your fibroid, and your overall health, right? You may receive a combination treatment. When we're talking about medicines, the Western medicine, there is two things that we're talking about. One is medication, right? And the other one actually surgery. Okay, surgery, right? Medication is used. We know that fibroid is the female hormone increase, right? Extra female hormone. There's still hormone out of balance. So what happened with using medication is you try to decrease those female hormone, because when the female hormone decrease, and it will eventually stop the menstruation and shrink the fibroids. Now you have to think about, is it what you want? Is it what you want? Okay. So in what situation do you want to do that? Right? Because stopping your period may not be something that you want. Okay. More importantly is you need to think about, do you want to have a baby? Because using the medication in surgery, and that is a bigger thing that you will need to consider about. But a lot of people, they had the baby, or they are not planning to have any baby, then you may not have to think about this. Most people go straight for treatment. There's one hormone called GnRH hormone. It's a very long name. I'm not very good in pronouncing it. So, gonadotropin releasing hormone, which is called GnRH. Okay, GnRH. It's an agonist, so such as lupulin. Pretty sure you heard about lupulin. Okay, will cause your estrogen and progesterone levels to drop, because those estrogen and progesterone level increase, that will stimulate the cell and grow, right? Then that become fibroid. So which means if we have anything that can drop the estrogen and progesterone, then you're successful to stop the growth of the fibroid. And eventually, when those two hormone, estrogen and progesterone, decrease and drop, and it will eventually stop your menstruation. And of course, the fibroid will shrink. Okay, this is the purpose. Right now, GnRH antagonists also help to shrink fibroids. They work by stopping your body from producing follicle stimulating hormones and LH, which is luteinizing hormone. Okay. So there are two things, two different hormone, right? We just mentioned that. They are another option. So this option is GnRH hormone is shrink your fibroid, right, as well as stopping your bleeding, right? And there are other options that can help to control your bleeding and pain. Now we know fibroid, it causes pain, it causes bleeding, and so there are other things that it can help you stop bleeding and pain, but it won't shrink the fibroid. It can't get the fibroid smaller, right? Which is LUD, that release the hormone progesterone, right? And overall over-counter like anti-inflammatory pain relief is only for pain, such as ibuprofen is for pain, but not for the hormone. Okay. Birth control pill. Birth control pill, it can help you stop the bleeding if you have bleeding a lot, but it can't actually strengthen the fibroid. Right. So there are different options. Which means if you're using this option, right, it stop the bleeding and managing the pain, but you still have your period. You still have your period. Okay. Now, there's another treatment that apart from taking hormone pill, that's surgery. Then surgery to remove very large or multiple growth may be performed. This is known as a myomectomy, which means there is two things: myomectomy, and hysterectomy. It's two different things. It's still a surgery, but two different things. Okay. Hysterectomy is I just remove the whole uterus. Remove the whole uterus. And that's still different. Remove the whole uterus, including the what's it can't remember the name. Ovaries, yeah. Does it include removing the ovaries or just leave the ovaries and there? So you just remove the uterus. So there's two things that you need to discuss with your surgeon. Okay, but normally just leave the ovaries and just remove the uterus. That's because that's the ovary is still producing the eggs and it still let it produce hormone to help to balance your body. And that is one of the options that commonly that suggest for patient. I have patients do that. Just remove the uterus, you know, and then one of the ovary got cysts quite big, so to remove that and leave one of them in there to try to balance the hormone. Okay, this is something that in Western medicines, and a lot of people do that. A lot of people do hysterectomy, and there's a lot of people. There's this one of the common disease that lead to hysterectomy, right? And there's another one called myomectomy. The myomectomy means that still keeping your uterus, but just remove the fibroids, whether it's just one or two or multiple, and just remove those fibroids in the uterus. Right, it's called myomectomy. The myomectomy now I think more and more and actually perform in laparoscopy, just keyhole surgery. You know, it gets some hole in your tummy, but normally 3. Then put camera in, insert camera, and then go and cut off your fibroid. But you be in mind that when it comes to surgery, and if you do myomectomy, which is just remove the fibroid will eventually might go back to after surgery. Why is that? Because the hormone is still out of balance. The what we call the progesterone and the estrogen are still high. If those are still high, and you're just removing the fibroid, and it will eventually go back again. Okay, so you need to think about it. So people may get the birth control pill to control it and remove it at the same time, that to control the hormone. Okay, that's one thing to do. But have you ever considered if people want to have baby, they will choose to have myomectomy to remove it. But at the same time, I would strongly suggest to have acupuncture and Chinese herbs to balance the hormone rather than take the pill. Okay, rather than take the pill, because there are a lot of side effects of the pill. So be in mind, if you want to have a baby, you want to do hysterectomy, right? Because if you do hysterectomy, you remove all the uterus, and you won't be able to have a children in the future. So what you do is you get myomectomy. That's normally the case that you will choose. Okay. Then happy days, can fibroid cause the breast to be bigger? Yeah, because of the extra estrogen. Yes. It may. Yeah. The estrogen increase. It may. Okay. Now, myomectomy. So with myomectomy, it just removes the fibroids. Then it doesn't actually remove the whole uterus. Then you want to balance the organs. So how do you balance the organs and hormone? And using acupuncture and Chinese medicine to work together, and to balance the hormone, so they can prevent that you get fibroid back again, and that can help you to have a baby. Because removing the fibroid doesn't mean your hormone will become better. Okay, that's something that you should consider if you want a baby, if you suffer from fibroid. Right? That's it for today, and I hope that you get some idea what's going on with the treatment and Western medicines. Okay. If there are any question, I would love to discuss with you, and please put down your question down there, and when I look at the question, when I see the question, I'll give you an answer. And right, thank you very much, and please share this video, and I'll see you tomorrow again for the diet. Okay, in fibroid, what should you eat? Because when it comes to treatment, Western medicine, Chinese medicine, acupuncture and Chinese herb, then and what can you do at home, which is acupressure point we talked about yesterday, and moxibustion. And I'm going to talk about the diet as well, because the diet is very important too. Right? I always, doesn't matter what coming, you always need to look at the diet, and as well as managing your emotional, because stress that cause the hormone out of balance. When the hormone out of balance, then they cause a lot of things, a lot of disease, and of course related hormone directly is fibroid. So you want to manage your stress. Okay, stress is important. That's why I say there are a lot of things that you can do. Look, every disease we talk about, when it comes to treatment, we talk about Western medicine, and Western medicine is just one part of the treatment, right? Then we talk about Chinese medicine, and Chinese medicine we talk about acupuncture and Chinese herbs, that you need someone to guide you, you need someone to see you and to prescribe those to help you, because you can't do it yourself. But when it comes to treatment, other treatment, those are Western medicine and Chinese medicine, someone need to involve to give you this knowledge and herbs and acupuncture, something like that. But the others that you can do it yourself is diet, acupressure point. We show you and you can do it yourself. Acupressure point, diet, and stress management. Your lifestyle changing. So you see 5 things: diet, acupressure point, stress management. Those 3 things that you can do it yourself. And whether you want to choose both Western medicine and Chinese medicine, or just Chinese medicine and no Western medicine, or just Western medicine and no Chinese medicine, whatever you go through, Chinese medicine or Western medicine, the 3 things that you can do: diet, acupressure point at home, and as well as your stress management. Those are a lot of things that you can do still at home, right? So I encourage you to keep going with my video. I'm going to go through a lot of different topic with disease, and then I'll show you how to do acupressure point that you can do at home. okay? And I'll show you what is the best diet for it, okay? Thank you very much, because my wife on PK and the quiz. Yep, I understand that maybe that is all due to the hormone. Okay, stay awesome. I'll see you tomorrow. Bye bye.